Do you have knee pain and are overwhelmed by which brace you should buy? In this video, I'm going to give you my doctor's guide as to which knee braces I recommend for what conditions. For those who don't know me, my name is Dr. Sonam and I'm an interventional sport medicine doctor. Let's review the different knee braces I recommend to my patients and what indications I use them for. So today I'm going to review the various braces that I recommend to my patients, and I'll show you a number of samples. I will also include affiliate links down below in case you're interested in looking at them in a bit more detail. So our first option is a soft compression sleeve. And as you can tell, there's zero stability in here, but it's a tight-knit compressive option. Now, how does this work? This works by providing a level of compression to your knee joint to help stabilize it. And the way it helps stabilize it, it increases the proprioception of your knee joint, so the ability of your brain to sense where your knee is in space. And because of that compression, your brain is actually a little bit more hypervigilant at stabilizing that knee joint. So people feel that they're much more stable, even though there isn't any rigid stability in here. So this is my entry-level knee brace option. And for those who have mild to moderate arthritis, who just need a little bit of compression and stabilization, mild to moderate instability, mild to moderate ligamentous injury, so like a very mild MCL, LCL, or anyone who's doing heavy weightlifting and just wants that additional level of support when they're working out. Then we have a soft compression sleeve, but with more rigid double hinges. Now these hinges are not extremely rigid in the sense that there's still some play. And how this knee brace works is it's put on the knee like this, and these hinges work to bend and flex the knee. So you still have flexion and extension, but you prevent any varus and valgus formation of the knee, which is that instability where the knee caves in and caves out. And because this is not as rigid, there's still a little bit of play, patients will find this very comfortable. Now, this also does have a bit of compression in it, so it also provides that increased proprioceptive ability for that brain to sense where that knee is in space to give you that extra level of stability. So what is this brace used for? This brace is used for individuals who need slightly more support than the brace prior. So think about mild to moderate knee instability, meniscus tears, MCL and LCL injuries that are a bit more severe than grade 1, so grade 2, potentially grade 3, and also mild to moderate arthritis. So this is pretty much a workhorse brace, and I use this for a number of my patients. I find this is one of the most popular brace types that I'll recommend because it gives that added level of support for my patients. So next on our list is a rigid double hinged knee brace, and these are metal hinges. So as you can tell, this is how the brace looks. You still have flexion and extension, but unlike the last brace where I had some play, there's zero play in here. The other special thing about this as well is these hinges can be locked in certain degrees of ranges of motion. So for example, if you didn't want a patient to bend any more than 30 degrees, we can actually do that with this brace. So this brace is highly specialized. Who do we recommend this knee brace to? So first things first, this is not one that I'd recommend where a patient would go over the counter and purchase it for use for mild instability. This is a very specific knee brace and a very specifically prescribed by either your sport medicine physician or orthopedic physician. We'll use these in very severe LCL and MCL tears where we want zero play in the ligament, and we also want to be able to limit your range of motion. It's also used in very severe ligamentous injuries and also post-op, so post-meniscus and ligamentous reconstruction. So usually if you need this brace, we are going to be prescribing it to you. So next we have an offloader brace. So this is a very complex brace. It looks very daunting, but it's actually very cool in terms of how the physics work. What we call this one is a right-sided medial offloader brace. And as you can tell, there's a permutation and combinations of a strapping system and a knob system. You put your knee in here, the kneecap goes here, and then what you do is you tighten this knob on the side. And what that does is it tightens up this area, but then it opens up and gaps open the inside aspect of the knee. So this is very good to offload the inside aspect of the knee joint. While this can offload the middle aspect of the knee joint, you can flip it and then offload the lateral aspect of the knee joint. So we can actually pick which compartment of the knee to offload and put less pressure on. So this is a really cool combination of different straps and knobs that allows us to play with physics to help offload different areas of the knee joint. What do we use this type of brace for? So this type of brace is really good for people who have developed arthritis in either the medial or lateral aspect of the knee joint. Most commonly, people will start to develop medial joint line arthritis. It's also very effective in those with either acute meniscus tears, medial or lateral, or degenerative meniscus tears, medial or lateral, because this will help offload the area. This is very specifically a prescribed brace, so this is one that we make the recommendation for you to purchase, not one that I tell you to just purchase off the wall, because we have a very specific ask. We need to know which area we are offloading and what condition we are using it for. Next, we have a rigid and flexible frame knee brace. So this knee brace offers a great level of stability laterally and medially, but very specifically, it also helps prevent the knee from going forward and back. So who do we use this knee brace for? This knee brace I specifically really reserve for those with really complex multi-ligamentous injuries, specifically including the ACL and PCL. So it can be used as a form of non-operative treatment if someone with an ACL or PCL tear does not elect to pursue surgery. They can use this while they're doing their activities. This can also be used post-op as well. So after they have a ligamentous reconstruction, this can help build confidence, but also if they're doing high-intensity activities like playing tennis, basketball, or even downhill skiing, this can provide that added benefit level of support. So once again, this is not a brace I would recommend you just pick up over the counter. This is going to be very specifically given to you by your orthopedic physician. So next we have our patellar stabilizing braces. So I'm going to show you two different types. Both of them work the same way. Let's talk a little bit about why we'd want to use these first so you can understand how they work. So these ones are used very specifically for kneecap issues. Think patellofemoral syndrome, think patellofemoral arthritis, and think patellofemoral chondropathy. So in many cases, the kneecap has this groove where it should go up and down as the knee flexes and extends. Now, unfortunately, in some of these conditions we talked about, the kneecap has the tendency to move outwards laterally, so moving to the outside aspect of the knee, and that's when you get pain. So the way that these braces work is they keep the kneecap midline by putting pressure on the outside aspect of the kneecap. So let's start with our most simplest option. So this here is called a patellofemoral J brace. And why is it called a J brace? Because you can tell there's half a J hanging right here. So the knee is essentially come inwards here, and then you'd apply this over the kneecap or just to the side of it so that it would hug the kneecap but push it inwards. And what this does is it prevents the kneecap from wanting to track outside, which will thus also prevent a lot of the pain that you'll experience. Now, this is just a more complex version of what I showed you. So this has now got the compression sleeve aspect to it, but you still have the J. You just can't see it as easily because it's integrated within the fabric. So the J brace is located here to help prevent outside movement of the kneecap. And as you can tell, there's actually a little Velcro strap here. So when you pull, it actually will pull and even create a bit of a stronger pull inwards so that you can actually customize this according to how much tension you need on the outside aspect of the kneecap. So the last type of knee brace I wanted to show you is actually the small little strap. So this here is a patellar tendon strap, and I'm going to show you a picture of where we place this. This actually gets put right in the middle of the patellar tendon in individuals who are suffering from a patellar tendonitis or a jumper's knee. It's a very common thing you'll see in the Olympics. So if you go back and you watch high jumpers or long jumpers, you see a lot of them wear this because a lot of them are riddled with patellar tendonitis pain. And last, I did want to mention K-taping. And the reason why is this can be actually quite an efficient way to help stabilize the knee or the kneecap or even the patellar tendon in those who do not want to use an external knee brace. So you'll find this a lot in people who are athletes and who are people who are actually engaging in active sport. I also find patients who find the knee brace is a little bit too clunky under clothes and who don't need that much support find this helpful as well. So this is always something to think about, and a good therapist can show you how to tape this. So that wraps up my doctor's guide as to what knee brace you should use for what condition. As you can see, there are a variety of options and a lot of them provide overlap. The most important part is to make sure you're comfortable with the brace that you choose. So I have patients go in, try them on. I really do encourage them to go into an orthopedic clinic to look into that. And if you do want to look at them online, I will post some links down below as well. If you have any questions or comments, leave them down below. For now, that's all.